Good morning, everyone. I welcome you all to third episode of The Surgeon's Perspective. Today we have with us Dr. Chetan Pradhan, a renowned trauma surgeon from Pune and a trauma specialist from Sancheti Hospital. Good morning, sir. Thank you so
Good
much for
morning.
joining us. The
Good
topic that
morning,
we are
sir.
going to discuss.
It's a pleasure to be with you once again doing a program with Healyos. Good morning, everyone.
Thank you so much, sir. So the topic that we are going to discuss today is falls and fractures in elderly, which is a very common phenomenon after the age of 60 that happens. And we all have questions about it. We all have some fears about it. And that is the reason why we decided to get Dr. Pradhan with us in a conversation today to tackle few of the most common questions around it, few of the most misconceptions around it. So let's get started with it.
Right.
So before we start, what are your views overall about why there are falls and fractures more common in elderly patients?
Okay, so let's see a few statistics. Saurabh. If you go by the current statistics, we have about 30% of our population, which is above the age of 50 years, and this population is going to grow over the next few years, so much so that over the next 20 years, we are postulated to have a lot of geriatric patients in the society.
Right, right,
Unfortunately, geriatrics or old age is not a very, I would say, looked after specialty, and therefore it's more of a neglected kind of branch in medicine.
true.
And this is a problem that we are facing now. That initially we used to see more and more young patients involving in trauma and fractures and injuries. But if you go by the current statistics, we have almost in my hospital, I would say at least one geriatric patient. By geriatric, I mean somebody who is beyond 60, 65 years of age, um, who is involved in a fall and who is involved in a fracture. So,
Right,
so this number just seems to be increasing.
true.
Another important shift that we see is that, especially in the metros, we have a lot of this population staying alone in their houses with their children either working elsewhere or they are abroad. And most of these older generation is left to fend for themselves. So we have an increasing number of geriatric patients who indulge in various activities, and they involve in various domestic kind of accidents, falls, injuries, and fractures.
Right,
In fact, it has been postulated that by 2030, by the year 2030, Asia would be having the largest density of geriatric population in the world, and
right.
and we are no exception. So we will have to gear up our our hospitals, our medical systems, and healthcare systems to cater to this population in a big way.
True, true. Looking at hearing the statistics of it, this surely is a very scary scenario, and we are very happy that people like you are sitting in hospitals and fixing these people so that they can get back to normalcy. And
Right.
another question that people have in their mind. So, me being a physiotherapist in our practice, we've seen that if for a patient to be hospitalized or to be taken to a specialist, sometimes there is a delay of about 2 to 3 days because symptoms were not seen or because patient is bedridden, isn't moving much. And so, what are the signs and symptoms that are there which will tell the relatives of an elderly person that this is something serious and should be taken to the hospital?
Yeah, that's a good question because see what happens is most of these patients are at home. They are
Right,
homebound. They are just very little ambulation they do, and therefore most of their symptoms remain masked. Now, for
right,
example, if you have a 75-year-old lady who, while walking, is complaining of pain in her hip joint. She would just carry on with with or without some medication. But honestly speaking, that could be a foretelling sign of a fracture in the hip,
Right.
which is called as a stress fracture. So that is an early sign, early indicator. So I would say any patient of this age group who has pain anywhere in the body should be
Right.
investigated in a proper setup. So we should
Right.
not ignore or neglect them. Now the question arises about those patients who are staying alone, so they don't have
Right.
adequate help. And most of these, about 60 to 65% of these falls are at home, if you go by the statistics.
Right.
About
Right.
20% of them are at public places where they may get help. But so many times they are at home, and that is where the delay happens because they
Right.
just carry on. They ignore those symptoms. They take some local medication, or somebody gives them some painkillers here and there, and these signs are neglected. So my
Right.
suggestion is pain anywhere in this age group, and there are very characteristic sites where you get these stress fractures or injuries. One of the commonest being the hip. The other common area is the spine, and the third common area is the wrist or the shoulders. So if
Right.
such a patient complains of pain in these areas, then they must be taken to a hospital. Uh, there has to be an X-ray which demonstrates whether there is a stress fracture or any kind of an injury or not, and then accordingly treated.
Right.
So without delay, they should reach a hospital, not ignore this, not keep on treating at home, and because I'll come to that in a while as to how early treatment can change the outcomes.
Right. Right. For sure. Thank you so much. And that is something that people would love to know, that what happens if the patient is not taken to a hospital immediately. So we'll surely get to that.
Yeah.
So when we have very less knowledge or very less education about how a medical emergency should be handled. We don't have that in our curriculum. We were never taught that. So can you please shed some light on the fact that what precautions should be taken when you're transporting a person to a hospital who has had trauma, specifically in case of elderly patients?
So it depends on where that patient is injured. For example, if the patient has pain in the hip or the spine, then preferably he should be transported horizontally on a stretcher, which means that
Right,
you will need to call an ambulance. And fortunately, now we have this 108 emergency ambulance service available throughout the country, and they are quite quick enough to come and transport you to the nearest hospital. And so, any injury in the lower limbs or the spine, the patient should be transported horizontally. Because what happens is in this age group, the bones are so fragile and so weak that inadvertent attempts at making them try to walk, and that's a common tendency. If you complain of pain somewhere, then especially in the limbs, then the bystanders or your neighbors would say, try to walk and see if you can do
right,
it. So instead of doing that, make them sit or make them lie horizontal or make them semi recline at 45 degrees and shift them on a stretcher in an ambulance. Injuries to the upper limbs can be easily put in a homemade sling. So you can take a dupatta or a bandage or anything and keep the entire upper extremity in a sling
right,
around the neck, in a cuff and collar kind of a sling, and take those patients to the hospital, and then necessary investigations can be done. Necessary investigations meaning at least an X-ray can be done. An
right,
orthopedic surgeon needs to see that X-ray, and quite frequently they are taken to general practitioners who may not be adequately informed enough to diagnose that X-ray. So they should preferably reach a hospital where orthopedic service is available,
right,
because like I said, they need emergent treatment. Now, that's not a
right,
life threatening emergency, but then definitely they should be treated within the next 24 hours. So, this
right.
is how you transport it.
Okay. All right. Thank you so much. what I would like to reiterate to our viewers is, so try not to move the injured or affected limb much. Try to keep it as rested as possible, and go to the nearest orthopedic center or where you have orthopedic services as soon as possible.
Yeah, so
Just
as a first aid, what you can do is make the patient comfortable,
right,
not give him anything to eat or drink, which is again a common tendency. Water
right.
is given or something is given. So don't do that because it
Mm,
may be a dislocation or a fracture which may require some procedure immediately. But then make them as comfortable as possible. Keep huge pillows underneath the limb or under the arm. Try to strap the arm to the chest using a bandage or something. So make the
right,
patient comfortable. Call an ambulance. Take them in either an ambulance, or if the injuries are not involving the lower limbs, then you can transport them safely in a car or even a public transport like a rickshaw, etc.
right, right. Important tip that you just gave in passing, in case it requires immediate procedure, anesthesia may be given, and because of that, any food or water should be avoided in case you have a fall which looks severe enough. I guess that's a very important tip to all our viewers, and it will help them in future. I just had a add-on question to this. You do keep mentioning early diagnosis in the passing. So what? How it helps in a recovery, the early diagnosis? Does that have any effect in the recovery?
Yeah, so let's actually go back a little bit and see the causes why these people get frequent injuries. See,
Right.
beyond a certain age, and in India it's usually 60, 65, what happens is there are very frequent falls,
Hmm.
and these falls usually lead to fractures, especially in women. There is a very characteristic tendency, and there's a lot of research on this also. This is not my own feeling, but then there is adequate research done on the fact that Indian population, geriatric population, is particularly prone to osteoporosis.
Hmm.
Overall, this population, especially above the age of 70, 75, has a tendency for frequent falls, and there are
Right.
various reasons for it. The primary reason being, slowing mental capabilities, uh, a balance which is not perfect. They may be on a lot of other medicines for their various other ailments which cause issues with their balance.
Hmm.
At home, the homes, our homes are not really old age friendly, in the sense the tiles may not be non-shade, the lighting may not be appropriate for that age group, especially yellow light, if you see, has a tendency to cause more and more falls. So,
Right.
or we do not have enough grab rails around in the house or in the toilets. So the commonest falls that we see are in the toilets,
Right.
and that's because the toilets are wet. The flooring may not be anti-skid flooring. There may not be enough grab rails around for if the person is falling to hold on to, and that is where these patients frequently fall down,
Right.
and uh, and that goes unnoticed or undiagnosed. Now, how many of our homes have phones in the toilets? Almost never.
Right.
So I have had patients who have fallen down with fractures in the hips or wrists or shoulders, and they're just lying down in the toilets or sitting in the toilets for help to come. Especially those who are staying alone, they just
Right.
cannot get adequate help soon enough because they cannot communicate.
True. True.
Very few people have a mobile phone being taken inside the toilet, and there are no landline phones inside the toilets like hotels have. And
Right.
there is a problem with communication. So I've had
True.
patients who have been lying down in the toilets for hours together till somebody notices and gets them into the hospital, and that's a very alarming situation because
It is.
by that time so much damage is done that
True.
it's very difficult for them. So
True.
early diagnosis is very, very important. There has to be a means of communication, especially for old people staying alone without adequate help in the house, as to how to communicate with the external world that they are having some problem. They have had a fall, probably it is a fracture, or some means of getting to the hospital quickly.
Right. Okay. Thank you so much for answering that. Uh, my next question is about what should the patient and relative expect once they are in hospital because of the trauma, the pain, patient is in. People are overwhelmed. They don't really know what has to be done, what should be done. So what can they expect when they come in a hospital?
So that is that is the importance of reaching the hospital early, because quite a few of these stress fractures, as I told you, are incomplete fractures and they can be treated without major surgery as well. So if the
Right,
patient reaches early and we have diagnosed it in that incipient stage of the fracture, then they can be treated even without surgery.
right,
But
right.
once there is complete fracture and
Hmm.
the patient comes to the hospital, usually what happens is if the patient is stable enough, then an X-ray is taken and the fracture is diagnosed. And depending on the severity of the fracture, a treatment plan is decided. Now,
Right,
this gets a bit complicated in this age group, especially because they are having a lot of other comorbidities, like a 75-year-old lady may be having diabetes, blood pressure, ischemic heart disease, renal problems, kidney problems, liver problems, or many other issues are there. They have a very fine fluid electrolyte balance, a very
right,
fine acid base balance. So most of the metabolic systems are working at a very borderline level.
right,
So it is difficult to immediately start aggressive treatment on these patients. So they need to be optimized for any surgical procedure medically.
right,
So as soon as diagnosis is made, a multidisciplinary team has to come into picture. And that is the important point that I'm trying to get at. That geriatrics is a specialty which is a teamwork. So it requires a physician, it requires a surgeon, it requires an orthopedic surgeon, it requires a person who is specialized in geriatric medicine. And now this specialty is actually coming up in a big way in India. We have the Geriatric Society of India. So we have specialists in our country, mostly unfortunately practicing in metros, who specialize in medical and surgical conditions of this age group only. So such a specialist
right,
comes into the picture. And then together we have to aggressively manage all the systems of this patient. So you cannot suddenly jump onto the fracture, take him on the table and operate on it. We
right,
have to see, the first thing that is done is to assess whether that patient can undergo surgery, whether that
right,
patient can endure surgery. Now,
right,
most of the hip fractures require surgery, shoulder fractures require surgery, wrist fractures require surgery. Now, it may not be a major surgery, but even a minor surgery at this age group becomes major
right,
because there are other conditions, and purely because of the age, administering anesthesia and operating on these patients is a task. It is a
right,
high risk issue. To to be able to endure that high risk surgery, the patient must be in a setup which has a very good ICU. So you have to have a good intensive care unit and an intensivist manning it 24 by 7, and only then you can embark on uh, major surgeries like this. But
right,
having said this, what the relatives can expect is quick diagnosis, maybe 24 hours for optimization, medical optimization of that patient. And on the second day, they can expect the patient to undergo surgery if everything falls in place. And
right.
within a day or two, discharge. Typically, we are looking at about 4 to 5 days in the hospital,
Okay, all
provided
right.
there are no other complications.
Right, right. Thank you so much for answering that in so detail. So my next question is about so like you said, there are a lot of factors that are considered before you decide a surgery is required. Just for a common people's understanding. So there is again a lot of phobia around surgery in an old age patient because they think after a surgery they might never be able to walk again. They will be bedridden. They might not recover at this age. So there are a lot of misconceptions out there about surgeries in elderly patients. So what factors are taken into consideration before deciding if it requires an operative procedure or not?
Yeah, that's a very good question because previously it was like that. Our systems were not really geared up to cater to, or very few hospitals had these facilities which I just mentioned in the previous question.
Right.
If you
Right.
have a setup which has a good ICU, which has a cardiologist, a nephrologist, all the super specialists in place, then today it is not so difficult or dangerous to operate on these patients.
Right.
In fact, the world has moved on to a situation where you can even operate on such patients the same day, and the outcomes are far better. The most important thing that I want to state here for all the viewers who are watching this is, in this age group, if that patient has to survive, then the entire focus should be getting that patient out of the bed as soon as possible. Now, when I say out of the bed, it is a multifactorial issue. So we have to quickly optimize that patient medically. All his systems have to be made optimal to be for the surgeon to be able to do surgery. The surgery should be a quick, minimally invasive kind of a surgery. So that surgery should not add on to the morbidity of the patient. And you need a very good rehab team,
Right.
physiotherapy and physiotherapy team, which is motivated enough to get these patients out of the bed as soon as possible.
Right.
But fortunately enough, the protocols in the world are changing so rapidly, especially for operating on these patients, that today a hip fracture in even a 100-year-old gentleman, if I'm able to do that surgery, that patient
Right.
will walk the next day,
Right.
and the survival rates have improved remarkably. So we ourselves at Sancheti Hospital are involved in a international multicentric study wherein we are doing, it's called as the hip attack. So it is a study on surgeries done on 80 plus or 75 plus years old patients with hip fractures. And if I just share with you the early results of this study, and we have studied more than 200 patients by now,
Right.
or if you are able to operate on the patients within 24 hours, and within the next 24 hours you are able to get them out of the bed, then their survival chances are above 90%, which were
Right.
not even 50% before.
Right.
So more than 90% of these patients have survived, and they have gone back to their pre-fall status. Now,
Right.
to be able to do that, you need to medically optimize. By this, what I mean is not wait for that patient to become normal. So gone are the days when we used to keep them in bed for 4 or 5 days, doing all other investigations and waiting for all their symptoms to become normal, because they never become normal
Right.
in this.
Right.
So you have to make them stable enough to endure that surgery. The
Right.
surgical techniques have now improved to such an extent that you don't need to do a lot of open cutting uh, job, or you don't need to open them up like we used to do before. A lot of minimally invasive techniques have come into um, picture, and with availability of technology, we are able to fix these fractures with very minimal trauma to the already injured patient.
Right.
And the implants, currently such good implants are available to fix these fractures that that patient can become mobile immediately.
Right.
These things are available the world over. Even in our country, they are available almost everywhere. But then the important point is to reach such a place where all these things are available. So you definitely need a ICU. You definitely need a
Right.
multidisciplinary team in place, and uh, even in smaller setups, all these things may be available on call. So if they are available, then these patients can be very effectively treated.
Right. Okay, thank you so much for answering that. So I guess that answers the most important question relatives of elderly people have. Ki, should I go for surgery? Like you said, there have been advancements in the field of medical science, which make sure that even person at 90 years of age will recover completely after the surgery. And I guess
Even
that's a
100
big
years.
viewers, because that has been the question in everybody's mind.
Right. So once the patient comes to such a patient comes to the hospital, even if he is 90 plus or whatever, the first thing that is done is to assess his fitness for surgery. The
Right, right,
anaesthetist will assess his fitness, the physician will assess the fitness, the cardiologist will assess the fitness. So all those tests are quickly done, and all these specialists will, once they pronounce him to be fit for surgery. Now there is always a risk involved in any surgery at this age group, But then think of it in such a way that if you don't do surgery, and if
True.
that patient remains bedridden, then there is a far more risk of that patient not surviving. Because a
Right.
bedridden patient usually dies of bed sores, chest infections, urinary infections, deep vein thrombosis, and there are enough n number of complications which can happen in a bedridden patient because
Right.
he's unable to get out of the bed. So there is a
Right.
risk of not operating as well. In fact, today there is a lot of mitigation in the risk of surgery. We have far better techniques of anesthesia. Nowadays, we do not give full anesthesia to such patients. We give only regional anesthesia, so only the part to be operated can be very effectively anesthetized. There are highly advanced techniques of regional anesthesia, which we routinely practice, and that allows you to operate only on that part without making that patient unconscious or paralyzed. There are advancements in intensive care. There are a lot of advancements happening in the field of general medicine, which or geriatric medicine, which allows that patient to survive and not only survive but become mobile. But
Right.
the thing is, or the crux is that they should get this treatment as soon as possible and get out of the bed as soon as possible.
Right.
So the sugars need to be controlled. The renal parameters need to be controlled. The other overall fluid electrolyte balance needs to be controlled. But this can very effectively be done within 24 to maximum 48 hours.
Right. And like you earlier explained, it requires a multidisciplinary team effort to handle such patients because of all these cases. I guess this video can be a reference point to all those people who are in a dilemma of going in for a surgery or managing it conservatively. Because I want more and more people to know this, that there have been capable hands at the hospital who are working towards getting people back on their feet even after a fall at such a old age.
Yeah, such teams are now available almost in all the
Right.
hospitals, and the outcomes are improving dramatically. If you see, in most of the hospitals, there is a geriatric unit now, at least in the
Right.
city of Pune, Mumbai, or wherever. And once this is done, the risk of surgery is nowadays far lesser than the risk of keeping that patient in bed. The
Right.
chances of survival of that patient and going to a pre-fall status is far more after surgery than without doing it.
Right. I think nothing can simplify it more than this statement. If anybody has a dilemma till now to go for a surgery or not, I guess this simplifies it completely.
And the risk stratification is done. So it is not that once the patient comes in, he is suddenly shoved into the operation theater and taken on the table. It's not like that. The risk is stratified. It is categorized into a high risk, a moderate risk category. All these risks are explained to the relatives, relevant consents are taken, and only after that surgery is done. So nobody would like to operate on a patient whom you know may not survive on the table. So
Yeah,
that factor is always there. But
of
what
course.
I'm trying to say is when you have such a team in place, then the chances of survival post surgery are dramatically better than what they were before.
Right. I guess we have discussed on pre-surgical factors that are taken into consideration, how a team effort is put in to assess the patient for its risk factors. I would like to talk a bit about what happens post the surgery. So you have been at Sancheti Hospital, you've been pioneered the whole early mobilization approach. So what
Right.
exactly is early mobilization and
So
how does it help?
yeah, so the world is now moving towards early mobilization almost all the trauma cases. Now, it is far simpler to do in a younger patient because one, he is motivated, his muscle strength is much better, his bone strength is much better. The problem comes when you are treating this age group. Now, there are three important issues that we need to deal with in this age group. The most difficult thing to deal with this age group is an inherent mental depression post trauma. So
Right.
after surgery, they'll end up with a post-operative delirium kind of a thing.
Right.
They just give up their will to move around and get out of the bed.
Right.
So your rehab team should first address that. They have to make them confident that yes, you can get out of the bed and walk. It is possible for you to walk. Most of these patients feel that now nothing is going to happen and I'm going to be bedridden forever. Now this is a concept which has to be driven out of their mind. The second issue is muscle weakness. Now, over the period, these patients are do not have that kind of a muscle strength to immediately walk or
Right.
come out of the bed. The third issue is the bone strength and the overall fitness level of that patient. If all these things are taken into consideration, it is a task to make them, mobilize immediately after surgery. But then today, you are an expert in that, but you will agree that the rehab protocols or physiotherapy protocols have developed to such a level that you can electrically stimulate muscles. You can start in bed mobilizations. We in fact start in bed mobilization on the same day of surgery under
Right.
regional anesthesia, where the pain is gone. The patient is made to stand up. Once he stands up and he takes a few steps forward, this mental block of not being able to walk goes away.
True.
The patient
True.
himself or herself feels, yes, I can do it. I think what this gentleman is saying may be true. I will be able to walk again. Once
True.
that confidence creeps in, gradually they make the effort to walk.
Right.
And with advanced techniques of rehabilitation, advanced technology of physiotherapy and all other exercise therapy, we can make them sit up in bed, do a lot of exercise, do a lot of chest exercises,
Right.
make them breathing exercises, pranayam, etc., and get them moving around. So this
Right.
is very important. It is imperative. It is mandatory to make these patients at least sit up in bed the next day, start breathing, start moving their uninjured limbs, and then gradually get out of the bed.
Right. I guess a bigger block, of course, the patients have that whole dullness towards getting back to normalcy, but relatives also have that mental block कि इतना बड़ा surgery हुआ है, let them rest.
Yeah,
And I guess somewhere that thing has to be, that myth has to be busted. So I always say this to my patients: see, a surgery is not an illness that requires rest. A
yeah,
surgery is being done so that they can get back on their feet.
yeah. So this is a concept which is very very prevalent in our society. कि
Right.
इतना major surgery ये age में हुआ है तो let them take this rest. But then that rest can at times become detrimental.
True.
And
True.
so, as physios and as doctors as well, we need to drive this concept out a little bit and make them understand that this is not going to work. There will not be a day where the pain suddenly goes away, the muscle
True.
power comes back one fine day, and the patient starts running out of the bed. This is never going to happen. What needs
Right.
to be done is bearing a little bit of pain. Pain control can be done. Pain medication and pain control itself is a specialty nowadays. But
Right.
if pain is effectively controlled and the patient is conscious and cognizant enough, then notwithstanding the emotions of relatives at times, we can
Right.
still make that patient move around in the bed and inside the wards as well. And this is what gets them back to their feet. They
True.
soon, within a day or two, within 2 to 3 days, they realize that making an effort is worthwhile because I'm able to sit up. What I was not able to do yesterday, I'm able to do today. I was hardly able to stand yesterday, but today I'm taking 2 steps. So one step at a time. But this is an era where we should encourage early mobilization after surgery.
Right. And I would like to thank you for because of surgeons like you, physiotherapists are able to do the real work, what they would like to do with the patient and not just do in bed passive movements.
No, no.
Earlier, the
Now
approach was such, yeah. And
the
we are happy,
protocol,
very happy for working with surgeons like you who allow physios to go a bit aggressive with the patients where they can return to normalcy faster.
no, I have a great team with me of
Right.
physios who are all super motivated, and
True.
I give them a free hand. I tell them do whatever you want, but I want this patient out of the bed, if not walking, at least on a wheelchair
Right.
tomorrow.
Right.
I've
Right.
I've done the surgery today, but tomorrow I should see this patient out of the bed. You
Right.
use all the techniques in your book. You use whatever modalities you want, but get them out of the bed. And
Right.
that is a strategy which has proven the world over to improve the
Right.
survival rate of these patients and to make them functionally better again.
Right. Right. Thank you so much for answering that. So we are almost at the end of our conversation. So my last question to you is, what we have talked about how it will be fixed and how patients can get back to normal. But can you give us a few tips so that what are the preventive strategies to reduce the risk of falls and its complications?
Oh, that's a wonderful question, but that's a 1 hour lecture on fall
Right.
prevention and preventive strategies, because that's a very very important aspect which our society will have to bring in to their culture soon.
Right.
And we will have to start from home. So we'll have to make our homes old age friendly. We will have to make the housing of these people old age friendly by improving the lighting, improving the flooring, improving structures around, decluttering these homes, because household clutter is one of the commonest causes of falls. Uh, the pets at times add to it. We have to
Right.
make the bathroom old age friendly. So it begins with modification of the house itself. As far as the patient is concerned, they need to have adequate supply or adequate intake of calcium. So about
Right.
500 milligrams of calcium supplement every day beyond the age of 60 years. Adequate intake of vitamin D. Most of our old people do not venture out of the house in sunlight. They are sedentary. There is hardly any exercise done, and therefore they are persistently low in vitamin D and calcium. And this
Right.
makes them very prone to osteoporosis, falls, and fractures. So it's calcium and vitamin D just does not make your bones strong, but they also make your muscles strong. So you need to do some exercise to keep those muscles working and the muscle strength normal. They must also do some balance exercises to keep their balance, walking balance normal. If they are unable to do that, they should use some walking aids like a walker or a stick within the house
Right.
also. I see quite a good amount of reluctance to using walking aids by these people. They are ashamed or they don't like it, but that's not the right thing to do, because they're just encouraging falls. And if they're on any other medication which can hamper their mobility or balance, then they need to sort that out with their physicians. So
Right.
adequate calcium intake, adequate vitamin D intake, adequate exercise, sorting out your medicines, and using walking aids. Maybe this is what can help prevent falls.
Right. Right. Thank you so much. It was a very wonderful session. You have simplified things for people's understanding, and I guess we have, through this conversation, we have addressed that never-ending dilemma of should a older person or a elderly in the house go for surgery or not in case of a fall. And I would like to reiterate, as the sir has said multiple times. So, in case any of your relatives, your parents have a fall, and just uh, don't just focus on managing it conservatively just because you have a fear that they might not work again. The chances of the risk, if you assess the risk, if they are bedridden, the risk of their whole life being not so active and moving around is way higher compared to a surgery is done. So thank you so much, Dr. Pradhan. It was a wonderful session. I personally have enjoyed this because I have been getting these questions all my life. So whenever there is a fall or there's something in a known circle of relatives, I get a call, ki, what to do. I guess I'm going to send them this clip for sure. Ki, just listen to this conversation on all your questions will be answered. Thank
Thank
you
you
so
so
much
much. Yeah, I
taking
hope
the
I
time out
have
of the
been able
Sunday morning.
to answer most of these questions. Uh, just as a last comment, I would again reiterate that there's nothing to be really afraid of undergoing surgery in this age group. Surgery, if required, is far less risky than what it was before, and just you need to take care of your old parents and people.
All right. Thank you so much. And to all our viewers, thank you so much for joining us today. And we are going to keep coming with different surgeons with different specialities and have their perspective and ask them questions that have always been niggling in our heads. Thank you so much, Dr. Pradhan, once again.
Thank you.